All right, we are live. Welcome, everybody. Hello to our weekly infrared laser call. 830 nanometer is what we're talking about today, and we will always be talking about because we're huge believers in this device. I will go to my grave saying that. We have Mike Barber, who is the inventor and CEO of Microlight Corporation. We have Dr. Bernard Filner, who is his chief medical advisor and his partner in crime for a long time. And they work hand in hand. They help people relieve or help manage pain in a world where a lot of people are looking for that. A healthy solution, maybe not leaning towards, maybe they have a reaction to pharmaceuticals like my dad does, and are looking for a solution that might be more on the holistic side. And since we are the holistic health haven, this is a place you want to come and learn more about natural remedies and how to bring humanity back to nature where we started. So today we're going to talk about knee pain. I will start with you, Mike, to tee up Dr. Filner, if you would. And then let's talk about knee pain. I know a lot of people have knee pain. And one thing I know about knee pain, Dr. Filner and Mike Barber, is when you have knee pain, walking is not fun. So let's talk about that today. So introduce yourself, Mike, and then introduce Dr. Filner, and we'll begin.
Sure. Well, Kim, thank you for inviting both Dr. Filner and I to join you today. Dr. Filner is our medical director. He's, been involved for almost 20 years, Doc. Would you say that'd be a pretty good guess?
20
Oh, a
years?
little over 20.
Yeah, a little over 20. He's pioneered the use of our device and laser trigger point therapy, as well as many conditions as as an MD anesthesiologist, pain management specialist. He's seen everything from head to toe. So, Dr. Filner, take it away, sir.
Well, the most important thing when you have knee pain is to try to determine the cause, whether you're dealing with arthritic symptoms, bone on bone, or some other traumatic problem. And once you've determined the underlying cause, then you can proceed to try to deal with the underlying problem. And the key here is once you've determined what the cause is, even with bone on bone, which normally will lead you to an orthopedic surgeon and a knee replacement. I have had quite a number of patients who have wanted to at least defer surgery they do have bone on bone, and you can do that. And that's without steroid injections and without dealing with the knee joint itself. One of the principles that are important is to understand that when you have these trigger points in muscles from your low back down, it can refer into the knee and can give you knee pain. And then the question is, where are these muscles? Where are the trigger points? And how often you need to treat them in order to help the patient defer any surgery if they have bone on bone, or you may be able to resolve the knee pain if it's purely from referred pain from muscular trigger points. And you can have any of these trigger points anywhere in your thigh, and it can be both medial, lateral, anterior, and posterior, can all refer into the knee and give you knee pain and dysfunction. And the important thing also is to look in the calf, because some of those trigger points can refer up to the knee. The fact is that there are very few low back muscles that will refer to the knee. There are a number of gluteal trigger points that can refer down to the knee. And a lot of it depends upon where you have your pain, whether it's a global knee pain or whether it's specific to underlying the patella or the kneecap, whether it's been diagnosed as a problem with where the kneecap is not going over the knee joint the way it's supposed to. That's almost always due to an imbalance of muscular function pulling that kneecap to the side, and can be pretty much resolved over time by invalidating those trigger points. So the key is, number one, diagnosis. Number two, evaluating the patient for trigger points, and dealing with those with the low power laser, where there's no risk and no pain involved in the treatment. So I think that's probably most of the would answer most of the questions that people with knee pain would have. So I think it's pretty clear once you really evaluate the patient's problem that you may be able to resolve it.
So that's kind of very interesting, Dr. Filner, that because I've heard a lot of people being told if you're bone on bone, there is no relief, no solution outside of surgery. And you're saying that may not be the case, right?
Yeah, I've taken patients sometimes up to 2 years, them being able to walk up and down steps, etc., to avoid their surgery if they have a reason. One of the most prominent cases I had was a patient who had had previous cardiac surgery and had, on induction of anesthesia, had fibrillated. And they brought her back, but she was extremely frightened about having another anesthetic. And I was able to defer surgery for her for over 2 years, resolving some of or most of the pain that she had, that she could supplement if necessary with just Tylenol. So the key here is proper diagnosis, and then exploring the possibilities of resolving the condition without any surgical intervention.
Oh, that's fascinating. I know there's a lot of people that are, yes, Mike, go ahead. I'm sorry. Go ahead.
Well, go on. Go on.
No, go ahead, Mike. I
You
want
know,
to, I'll bring that up later. Yeah.
well, Dr. Filler, can you explain to our listeners clinically what the laser is doing to the trigger point and why it is so helpful and non-invasive?
Well, basically, what the low power laser does, because it does not cause pain or localized heat or have any potential risk to the patient, it's an ideal way to help with the diagnosis as well as to treat the problems. Trigger points can, Dr. Travell discovered this probably more than 50 years ago, that these trigger points in muscles can refer, in addition to being painful, can refer pain. And when they refer pain, the muscle is often tight and can create symptoms because they do not stretch normally. So when you inactivate a trigger point, it basically allows the muscle to stretch, and that's actually part of the treatment for trigger points. Once you inactivate the pain, which you do with the low power laser, you can then stretch the muscle without pain and resolve some of the referred symptoms. The key here is what the laser does is it increases blood flow into the area by allowing the cells that line the small blood vessels to release nitric oxide. And nitric oxide is a vasodilator, so the circulation increases, and it allows for many of the compounds that have collected in these tight muscles to be flushed out. And that allows the muscle to be more relaxed and the pain to dissipate from the trigger point itself. And the other effect is that the laser can inactivate the C fibers that carry pain from the trigger point to the brain. And that's the second function of the low power laser.
Amazing. Mike, go ahead.
Doctor, yeah, how many cycles on the trigger point? How many cycles do you use per trigger point?
I've discovered over the course of the 20 years that I've used it, and I've tested it on every different number of cycles. For a trigger point, it's 5 cycles is ideal. 4 is usually not enough. 6 is not necessary. So 5 is the ideal, assuming all you're trying to do is to inactivate the trigger point. The laser can also have some other functions in the area, particularly for stopping a migraine headache or doing some other pain relieving situations. And that might require a different number of cycles, depending on what you're trying to do.
You have another question for Dr. Filner, Mike?
Nope, that's it.
Okay. I know your signal's off and on today, so I didn't want to not follow that up. So that's actually very encouraging, Dr. Filner, because I get a lot of questions a lot on knee, bone on bone. So you're saying if there's a condition with your discomfort in your knee, first you need to, if you have a laser or you can find a laser provider, you want to address the thigh muscle and the calf muscle first, correct? And work on the trigger points.
Correct. It's and the important thing is spending the time it takes to find the trigger points that may be there.
Yeah. And how many treatments do you think that normally takes on average?
Oh, I would say on average, probably anywhere from 3 to 4.
Okay.
Again, depending on the intensity of the pain the patient's having and on what they do in terms of the stretching exercises that I would prescribe. Because as you stretch these muscles, the trigger points become less active. So what I used to do was to take have the patient bring in a cell phone, and I would take pictures of where these trigger points were and the stretching exercises that I prescribed for the patient. And if they had a significant other, they could have the patient then look at this and get treatment, because sometimes some of these trigger points are in the back of the thigh or down in the back of the calf, and the patient can't reach them on their own. I can reach them, and a significant other, a friend, a neighbor, a husband, a spouse, if they have the cell phone tape, they can follow the instructions that I give and do the treatments, and therefore decrease the number of times a patient needs to come see me.
That's really good news that they don't have to come see you anymore, right?
Yeah, it's not so much anymore, but less often. And that's one of the real advantages of having the cell phone. And it can really help the patient deal with their problem.
Well, that's incredible. I know. So when you apply, let's say it is okay, here's one, Dr. Filner, I hear all the time is, and I've seen this firsthand, is someone who was told by their doctor that they have a torn meniscus and they require surgery. I have seen evidence of the 830 nanometer getting incredible results to the point where the person doesn't even feel the condition anymore. I don't understand it. I'm not a doctor, but what's your thoughts on that?
I think the likelihood is that the diagnosis was not correct. One of the problems with the MRI scanner is that it's very difficult sometimes to tell the difference between something which is torn or disruptive versus something which is inflamed. And if they've overread the MRI scan and it's the meniscus is not torn but is just inflamed, not only can you help with the symptoms by treating the laser, but there's also increase in the circulation of the synovial membrane, which may help if there's a very small tear, can help it heal. And that's even true of cartilage. Cartilage can, in fact, be healed if it's primarily inflamed, because the synovial membrane can, in effect, feed the cartilage or the meniscus and allow it to heal. If it's totally disrupted, and it's in two pieces, it's going to need to be either removed or repaired, whichever the orthopedic surgeon feels that they can do.
You know, that's interesting because I think it should be your first, your first decision is to go and find someone who actually uses the 830 nanometer laser. And why I think it's really important for you to understand that that all numbers are not equal. And you think that should be standard, but I know that it's not standard in the infrared space because there's a lot of hype, a lot of misinformation, a lot of false advertising. And microlight the invention of microlight is the 830 nanometer. And the significance of that number is powerful. And I'm going to lean over onto you, Mike, because you brought it to the market. Why all lasers are not created equal, and why the significance and the power of the 830 makes a huge difference in the results.
Well, Kim, my background is surgery, so we had a surgical laser training institute, and in the early mid 1980s, I began to understand how different wavelengths worked with different tissue. So we were using class 4 lasers that would either cut, coagulate, or vaporize tissue. And so doing training doctors there for 5 or 6 years, in my world, laser therapy was a joke. And it was like, okay, if you think laser therapy works, then go down to Office Depot, get half a dozen, laser pointers, get some duct tape, and treat your patient, and you're going to have a placebo effect of at least 30%. So, I mean, that was my view of low-level lasers. But I picked up on some science out of Japan. Dr. Oshiro, it's on my website, the same article I was reading in 1990. And it was clear to me that he discovered a wavelength that got 2 to 3 inches subcutaneous. It vasodilated the small microcapillaries. It didn't have any thermal effect to the tissue, and that he really found the magic bullet. And he had over 5,000 double-blind studies or cases of double-blind studies, and it became their gold standard in Japan. And since that time, it's become the gold standard around the world. So I was early enough into lasers that I knew they had the magic wavelength. So I patented in 1918, gosh, I had a patent anyway, later 90s. So then when we got FDA clearance doing the General Motors study, that we became the predicate device, which is a whole different story. But nobody could copy my power and wavelength. We had to sue several people, had to write a lot of nasty letters. So that's why we have the only 830 wavelength in America that clinically does what you've heard Dr. Filner talk about.
Yeah, well, I've seen the difference too. And if you're looking at this, let's say you're a physician and this is the first time you've heard of anything like this. This is something that is a powerful. It's been on the market almost over 25 years. There's over 25,000 clinics that currently use this device. And just know that it would add to your current practice in pain management. And then if you're also a physical therapist or a massage therapist, it was also add to your helping your patients as well. And then if you might be saying, you know what, I just believe in this device. Could I actually buy one and actually become laser certified? Yes, you can become laser certified. I would recommend you get OSHA certified, so you know the safety precautions. Although it is very safe, there's never been any contraindications. But there's some of the lasers. So there's another question that leads me into the difference between class 4 and class 3B lasers. Mike, you want to address that? Because it's a little big, it's a kind of a big deal, isn't it? I think he.
In my world, a class 4 laser is a blowtorch.
Okay.
Can you hear me?
Yes, yes,
Can you hear me?
yes.
In my world, a class 4 laser is a.
Oh man, he's bad signal. So I know, Dr. Filner, you can answer that question.
Basically, what he was saying was that the class 4 laser is a blowtorch because its power is the way they're classified. A class 4 laser has to have a certain power. The wavelength is not as specific as the power. And once the power gets above a certain level, it's called a class 4 laser. And class 4 lasers are used in the operating rooms to cut tissue, vaporize tissue, and it creates these effects by creating tremendous heat. The class 3B laser does not create heat in the tissue. It's a huge difference, not only because the patient won't feel anything, but because it will not damage the tissue. Whereas the class 4 laser has to be only activated for a second or so in order to actually avoid acting as a blowtorch and vaporizing tissue.
He covered you, Mike. You have bad signal today. Go ahead. Can you hear us? You're muted, Mike.
The other device out there, which just gives me an enormous amount of heartburn, and I'm not even going to mention the company, although their name starts with an E. They're selling laser pointers. They're selling 635 nanometer wavelengths. Could be a 412, which is.
Oh man, he's got bad signal today.
Yeah, basically what he's talking about is many of the so-called low power lasers that use different wavelengths and different powers that are very low are function basically like the laser scanner in the grocery store or laser pointers. And they do not do anything to the underlying tissue in terms of inactivating a trigger point.
Well, I've seen the effects of your
Doc,
device. Go ahead, Mike. Sorry.
no. I think you have a story to tell about your personal story of laser pain relief.
Well, I never get tired of telling it. I had two actually reversals of a condition I had suffered from 9 years, an ankle injury with 11 pins and a plate, two treatments of a total of 10 minutes each, so total 20 minutes, reversed my condition of my ankle after surgical, 11 pins and a plate, inability, constantly getting swollen ankle with edema where you can kind of push in on it and you could it was bad. A lot of inflammation. But in 20 minutes, I could walk normal again, where I hadn't been able to do that for 9 years. And then my TMD, which some people consider TMJ, I guess the technical term, Dr. Filner's TMD, that was also a 9-year injury that every day I would just wake up with hopelessness, that my jaw was just constantly in aggravated state. You could actually see the muscle spasms in my jaw. So there were even 4 months there that I suffered from migraine headaches all day, every day because of that condition. So pharmaceutically, they gave me a strong painkiller that I knew wasn't good for my liver. And so I didn't have much hope, Dr. Filner and Mike. No one ever said that there was hope until I was introduced to the 830 nanometer. I tried it. I got results, and I knew I could try. I didn't have anything to lose. And so my jaw was just as significant to me in my life as my ankle for walking, because I do a lot of talking. And I have been doing a lot of talking for a lot of years, presenting and talking and educating. So, so Mike has gifted me with, I am free from pain, and that's because of Mike's device. And so, Dr. Filner, as we get closing out here, so what do you suggest on when you first see a patient come in as an evaluation? What's your first step into evaluating somebody? Says, Dr. Filner, my knees are killing me, or my knee is killing me. Do you have like a protocol that you follow initially?
Yeah, well, the first thing I ask about is, number one, the history of the injury or of the pain course, when it started, what set it off, etc. Then the treatment that they've had previously. And once I understand where the problem has been coming from, I follow this by telling the patient that I think I may be able to help by looking at the muscles in the thigh and the calf. And as I find these trigger points, I inactivate them with the low power laser, and the patient looks at me like I'm some sort of stranger from outer space, because they've never been
That's
told before that anything could help. So that's what I follow, and I spend a minimum of an hour with every patient that I see, and an initial visit might last 2 hours, depending on the problem. Just briefly, one of the things that you mentioned, the TMD versus TMJ, if your physician who examines you makes a diagnosis of TMJ, the insurance company, unless you have a problem within the joint itself, they'll reject the claim. TMD is a muscular problem that's treatable. And just as a patient that I saw when we were recently, or it was last year, at a conference of migranters in Minneapolis, I saw one of the people in attendance who she was in her early 20s, and she said ever since she had been 6 years old, she had been unable to open her mouth more than about 3/4 of an inch. If she tried to open it further, she developed a severe migraine. And I palpated her jaw muscles and some of the muscles in the upper part of the neck, and she was able immediately to open her mouth about over 2 inches. And she started crying because that was the first time she had been able to do that in almost 20 years. So that, in effect, we were treating the underlying cause of the migraine that she was having, and proving that almost any sort of trigger point problem that causes severe pain in select patients can set off migraines. And
So we're going to close out here, Dr. Filner. I see, Angela, I see your question on sciatic pain. That actually was a really good subject. We'll talk about maybe even next week or the week after, because that's a really good subject. And then she asked from you, Mike, what is a field of expertise that would be more apt to actually look at this type of technology in the medical world? What is that?
well, yeah, obviously the chiropractic community there in America. I don't know if I don't know where she's calling from, but in America you have about 70,000 chiropractors, physical therapists. You've got 250,000 physical therapists, and probably the group that has not had as much activity to it is massage therapists. You've got over 350,000 massage therapists in America.
Yeah, and what you should
so,
always think about is a physical medicine doctor. In their training, they're the only medical specialty where they're introduced to the concept of trigger points, so that they might be a much more fertile, in terms of MDs, fertile area for using this technology.
All right. Well, we're
Kim throw in about 150,000 athletic trainers as well.
ooh, that's a good there. That's true. All right, gentlemen, it's been a pleasure as always. Tune in next week at 2 p.m. Eastern Standard Time, right here live in the Haven. We love you guys. We appreciate everything you're doing for humanity. Let's keep bringing humanity back to nature. And it's one step at a time. We need a lot of people doing it. Love to you all. Share this video if you think about somebody. Tag someone in this video if you know that they're suffering and there is a solution out there. All right. See you guys next week. Bye, Dr. Filner. Bye, Mike.
Bye-bye.